Bloomhill Cancer Care is a community cancer care centre, and it's here to provide personalised care for anybody living with cancer and their loved ones on the Sunshine Coast. So we have a range of wonderful allied health services, therapies and activities to enhance the well-being and quality of life of people living with cancer. Things like exercise physiology, dietitians, physiotherapies, lymphedema therapists, acupuncture, massage, reflexology, and activities like yoga, Pilates, Qigong and meditation. So the Bowel Cancer Clinic came about through a partnership with Bowel Cancer Australia, and the idea was to have a dedicated support person in the community to provide support for people living with bowel cancer. Whilst bowel cancer is the third most diagnosed cancer in Australia, it doesn't receive the same support and awareness that other cancers seem to be, and there's still a stigma around bowel cancer, which means that people living with bowel cancer don't often feel seen or heard or really want to speak about what they're going through. So this is an amazing opportunity to bridge that gap and allow equity of support for all people living with bowel cancer that other people tend to get with other cancers. My role here is to meet with people that have bowel cancer diagnosis, and I spend a lot of time to get to know them, find out how they were diagnosed and what treatment they've been on, what side effects they're having and how they're struggling with that, but get to know them more holistically. So finding out who's in their corner, who are their support people, how are they coping with their life, are they working, do they have children, and provide that holistic assessment. And a part of my role is to get out into the community and educate people on how they can reduce their risk of bowel cancer and also the importance of bowel screening. We're also building relationships with our local hospitals and other treatment centres on the Sunshine Coast and getting direct referrals to the Bowel Cancer Clinic from other service providers in the community. Running this clinic has really challenged me and pushed me out of my comfort zone to do things that I would never dream of doing or hadn't experienced before in my nursing career. Giving in-services to other service providers, education sessions, talking in front of 100 people about bowel cancer prevention. I'm not naturally a public speaker, so that's been really challenging, but I've really enjoyed extending myself. If anybody is thinking about setting up a nurse-led bowel cancer clinic, I would suggest don't be afraid to ask for help. Talk to the people that you work with and get their ideas on how this clinic can be a success, and get support from APNA.